In this video, you will learn what happens with your baby this week, what happens to your body, things to do or consider this week. Feel free to leave a comment if you have questions. Your baby's body is constantly developing. In the first weeks it mainly consisted of cartilage, but now that you are 15 weeks pregnant, almost all the cartilage has been converted into bone. At 9.4 centimeters and 65 grams, your baby is as big as an apple, as heavy as a currant bun, and is covered with layer of fine hair. If you are 15 weeks pregnant, this is the last week that you can have the NIPT test performed. NIPT stands for Non-Invasive Prenatal Test. The NIPT is performed to screen for the most common chromosome abnormalities, such as trisomy 21, Down syndrome, trisomy 18, Edwards syndrome, and trisomy 13, Patau syndrome. The NIPT test is a DNA test that consists of taking a number of tubes of blood from the pregnant woman. The mother's blood contains DNA containing genetic material from the baby. This DNA can be analyzed to detect the chromosome abnormalities. When you notice that you have a headache, it is important to take it easy. If you don't do this, you run the risk that the pain will only get worse. Often these headaches are caused by stress. In addition, a poor diet can also cause headaches. When you notice that you suffer from headaches or dizziness, it is important to take a break. It is advisable to make an appointment with the dentist around this time. There is a good chance that your eating habits have changed due to your pregnancy. This can affect your teeth and gums. Did you experience a lot of nausea and vomiting during the first period of pregnancy? The acids that you spit out are very bad for the tooth enamel. An extra reason to make that appointment with the dentist. Are you worried about your pregnancy? You're certainly not the only woman who experiences this. Perhaps it is good to consider that the chance of miscarriage is relatively small if you are already 15 weeks pregnant. If things go wrong, it is often at the beginning of the pregnancy. Are you doing well this week? Then you have passed the critical phase. The size of the belly differs from woman to woman and usually says nothing about the size of the baby. For example, if your abdominal muscles are strong, your belly grows less quickly. However, this will not stop the baby from growing and developing. Most pregnancy courses only start when you are 24 to 28 weeks pregnant. It is therefore recommended that you register at about 15 weeks pregnant, so you will have a slot reserved. If you register at a later date, there is a good chance that the course is already full. At the midwife, you will find brochures and information about the different types of courses. For example, what do you think about a pregnancy yoga course?